as a gastroenterologist, all those procedures I did, all those lives I touched, hopefully all those cancers I prevented, all those people who I went to see in the middle of the night, that made a difference in people's lives. But then there were days where I wondered whether colonoscopy after colonoscopy was actually serving the greater good for me, like when, or for people. If the end game is to prevent cancer for the bread and butter gastroenterologist, are there more effective ways to do that? And that is coming to the forefront now.
Dr. Fehmida Chipty, a warm welcome to the Scope Forward show. I'm so excited that we're having this conversation. But before we begin, a very, very warm welcome.
Thank you, Praveen. It's very nice to be here.
Before we get started, I just want to read out your background for our audience. So Dr. Chipty is a Boston-based gastroenterologist, photographer, and a facilitator. She is the Chief Operating Officer of NovoLiver, Satya Health Sciences, a company that I'm a part of as well. In her role, she brings nearly 30 years of clinical experience to the emerging digital health industry. Through her medical career, artistic practices, travel experiences, and community service projects, she has the opportunity to connect with people across generations, across cultures and communities. She also founded Zamana Art in 2014 as a creative platform for engagement, connection, and social impact. So Fehmida, let me ask you a question quite directly. So you left the field of GI. Why did you leave the field of GI?
23 years that I spent in my gastroenterology practice were wonderful. I mean, incredibly supportive colleagues, a group that was really committed to patient care and high quality patient care. There was a part of me that was stirring to do something else for a long time. There were passions and interests that I had. There was a part of me that needed to become whole, that just was not becoming complete doing what I was doing. And the journey in developing myself as a photographer brought that to light for me.
Yeah, but people might argue that you could have done this on the weekends and done your endoscopies during the week.
I was doing that, and I was doing that for years. But I felt that there's a part of me that needed so much more than what GI was or medicine was giving me at that point. And part of those were my desire to travel, my desire to be there for my family in ways that they needed me now more than ever before. Pieces of me were everywhere. Now, Praveen, I have to tell you that pieces of me are still everywhere. And I realize full well, and I've come to realize over this last 3 months, even since I left my practice at the end of the year, that I am that kind of a person. I am busy all the time and I stay busy, and I thrive on that, actually.
But one would think that you'd be on perpetual vacation after leaving endoscopy. Is that not true?
So I want to just step back and say that leaving my practice was very hard to basically make sure that I left everything in a good place, especially for my patients, was very hard. But my official end of my practice was on December 31st. And I think you might recall that on January 3rd, I called you and I said, Praveen, what can I do to help? And I have been very busy since. I took a couple of weeks to straighten out my personal things because I was traveling to India. I had already made a plan to travel to India in mid-January. I had gotten involved with this startup called NovoLiver, which Praveen is also a part of, more sort of as a design creative consultant with the website and the app that NovoLiver was developing. And I loved doing that. It was so wonderful to use my creative abilities. And while I was doing that, I was thinking, wow, this is an amazing organization. And I think it will have a lot of impact on a lot of lives. So when I finished my practice, instinctually, the part of me that wants to help in general and make a difference, I think reached out to Praveen.
Since January, what do you do in the organization? What does
Yeah.
work look like in a digital health company? I mean, you ended up back in medicine. You think you're not in medicine, but you're square back in medicine. Just that it's population health and it's wellness rather than
Right.
one-on-one patient care.
So I'm going to just tell you what the process was from the day that I spoke with you that day. But I had been thinking about how this company would be able to grow in India. And why India? Because I'm originally from India. I go to India every year. I love being there. And there's a part of me that's still very deeply attached to the country, the culture, the people. So I had been thinking about how the company could grow there. And I had a couple of ideas, if you remember, Praveen. I put them out there. And I had actually followed through on them and made some connections with some corporate people that I knew. But I didn't realize that I myself would be coming to India to put those relationships in place. You asked me to talk to our operations person there. And the minute I started talking with her and seeing what the need was, this part of me just said, well, yes, we can do this to make this work or that to make this work. It was just very natural and intuitive to me, and it fit my personality. And I realized that I've been doing that kind of thing my whole life. And I'm able to compartmentalize. I was able to do my practice, that my procedures days, I was able to focus and do that. The days that I was in the office, I was able to focus and do that and manage my life, my other life separately. But this gave me a chance to do all of those things that I've been doing my whole life in sort of one package. Yeah, I came to India, met Praveen for the first time, actually. And we had a few meetings. And Praveen, I remember you said this to me. You said, I think we know the way forward now. And you asked me for help. And I said, I would like to help. And I went back that night, that very night, and I talked to my husband, and I talked to my sister, who's a very accomplished businesswoman. And I said to my sister, I said, what do you think of this? I said that Praveen's asking me if I will, head operations for Satya Health Sciences, NovoLiver. And I said, I'm not a finance person. I am not a business person at heart. What do you think? And she said to me very clearly on the phone, she said, you are the perfect person to do this. She said, you understand people. And this is what this company is about people. She understood the mission. And honestly, it completely resonated with who I was.
Clarity, for people who are listening or watching this, NovoLiver reverses fatty liver disease through a 4-pillar program that goes around diet, exercise, sleep, and mindfulness practices. And Fehmida Chipty heads the operations. She's the chief operating officer for the startup in both countries, India and the US. I want to take a step back to the field of GI and ask you, quite openly and quite directly, what are the problems in the field? On the ground, what are the problems that a gastroenterologist, an endoscopist faces every day? Maybe we don't talk about it, but it's there.
There are a lot of different issues, Praveen.
Okay.
And I think they kind of creep into your life very slowly. And you kind of keep saying, it's okay, I'll manage, or I'll do more cases, I'll see a few more patients, and I'll make it work. But it comes at a cost, right? So I remember when I first started my practice, and this was many, many years ago, I literally set up shop. I mean, there was no turnkey operation for me. And I let it build up slowly. It actually gave me a chance to figure everything out for myself, which I love to do. But I was able to run my practice with one person in my office, and I think do just as good a job as I was doing my last few years when I had a very large operation and an endo center that I was a part of, there were just so many people involved. And not that everybody didn't have an important and appropriate and necessary function, but there were just layers and layers of complexity that were added on to the organization. The hospital relationships became more complex. Our hospital was essentially acquired by another larger hospital system. There was a lot of pressure to become part of that PHO, which we as a practice, because of our size, we resisted. Our endo center, we partnered, with a larger management company. And overall, the relationship was good. But, again, everything was more complicated. Finances, the relationships, the expectations. And I will say very honestly that, my practice and my partners did an amazing job of balancing life and work life obligations.
When you say it became complicated, do you mean that there was an unsaid push for more volume or more procedure?
Yeah, I mean, there's always an unsaid push for that, right?
Okay.
And then the relationship with the hospital also got more complicated during COVID. So, first of all, let me say and put out there that it was very stressful for physicians during the first few months of the pandemic. And we actually have one physician who, was in his 70s who, worked just as hard, worried just as much about his health, but showed up for his patients, and we all did. I remember the fear that my husband and I had in the early months of this as to how we were going to keep our families safe. My elderly parents, his elderly mother, but still we showed up, we did our work, we did what was necessary, we learned to adapt. But I realized that physicians are always asked to adapt. Physicians are always asked to sort of say, what will we do next to help the next person? And you know what? That's our nature. But when will we say that, I need something? Or I need to reassess my life and see what my heart and my soul needs. So, like I said, my mother getting ill was a big piece in that, but I think this was all coming. It was all coming. My other wants and desires to explore my creative side. I do feel that as a gastroenterologist, all those procedures I did, all those lives I touched, hopefully all those cancers I prevented, all those people who I went to see in the middle of the night, that made a difference in people's lives. But then there were days where I wondered whether colonoscopy after colonoscopy was actually serving the greater good for me, like or for people.
Can you explain what you mean?
If the end game is to prevent cancer for the bread and butter gastroenterologist, are there more effective ways to do that? And that is coming to the forefront now. And I think that a lot of you will relate to the fact that we just do procedure after procedure. And sometimes we wonder, right, whether there are more efficient and more effective ways to really deliver population health in terms of colon cancer prevention.
It's not very polite to talk about money, but the advent of managed care made sure that physicians get compensated based on volume. And my observation from the outside is somehow that seems to also drive things. What's your view, or what did you observe on the inside?
So absolutely. I mean, I think that when people know that they do more procedures, they'll earn more money. That's going to factor into what they do, especially though, in fairness to those of us who are on the ground doing the work, overhead is going up and up, right? The reimbursements did change. And it's not to say that we weren't always making a good living, right? So that's not to say that, but the pressures to produce definitely changed. And so if the correlate is you do more cases, you earn more money, then the volume drive will happen. I have to say, I don't see that my colleagues were doing unnecessary procedures, but the volume is there and you can drive it. The volume is there and appropriately also you can drive it. but I want to talk about the physical aspect of this.
Please.
And you might have had that in the back of your mind. What toll does this take on our bodies? Like, I will be very candid that beyond like 11 procedures a day, it was physically hard for me to do cases. Now, I will tell you that most of my patients were women, and it is a fact that female colonoscopies are more complex. At one point, I started keeping track that how many of my patients actually had intra-abdominal surgeries. And you all probably, who are watching, know the number of women who have had or who have surgical abdomens. There are more adhesions. The procedures are technically more difficult. So before our unit was fully with pediatric scopes, I literally used to get cramps in my hands at the end of, if I had a day with 10 colons and whatever number of gastros, my hands used to hurt. As the scopes got better and more responsive to, to hand maneuvers, that improved. I mean, I had to learn ergonomics. I mean, I was very, very cognizant of how I held my body, how straight what position I had my wrist. I actually varied my stretcher length up and down during my cases or between cases. Unfortunately, the neck position where the screen was, right? If I was sharing the room with a particular colleague who was much shorter, and I was the shortest in the group, and it was difficult to move that up, and I had to sacrifice that. So I let that be, and then I would sort of manage and make sure I turned my head. I mean, there were all these pieces that I had to constantly be thinking of. And if I didn't, I know people even outside my group who have issues with their neck, their back, their wrist.
Endoscopists talk openly about this. I know they've talked to me on the side, but
No.
like, let me ask you why. Why don't people talk about an issue that perhaps affects them, stresses them out every single day, I would assume?
3 or 4 years ago, I can't remember our practice, our PA left, and we have a very busy hospital service. And we take turns in the hospital being on service for a week at a time. And those weeks can be insanely busy. And I know that, I tried when I was on call at night, I would call the person, the hospital doc, as we called him or her, and say, how can I help? They would never ask for help. They would never, and I would never ask for help. I would never ask for help. I would basically just say, I can do this. I don't know whether we're afraid we're going to look weak, whether we're going to look like we can't do our job, whether it speaks to our competence, but we don't ask for help. Physicians don't ask for help.
So when you look at all this from the outside, when you're reflecting, about that phase, what do you think? Like, is it really, is somebody incompetent because he or she asks for help or expresses saying that, hey, this equipment is not suiting my body, or this position is not suiting, suiting my physical body, and I can't do more procedures than this, or even question like, why are we doing as many procedures when it was not designed to be done when we began this journey? What do you think?
Oh no, I completely agree with you, Praveen. I think what you're implying is that this conversation needs to be had. I mean, it's almost like in every endo center, people need to evaluate what they're doing and what they should be doing as a practice, and as individuals within the practice. Because, somebody who is physically much bigger than I am, for example, may have more bandwidth to do a certain kind of procedure, a volume load. But then I'm not saying that I'm able to do more technically than anybody else, but I will remember a day when I had to cover for a colleague, a male colleague who was out. And I had so many more male patients that day because normally I have probably 80, 90% people. The day was physically much easier for me. So what kind of patients are each of us getting? All of these factor in, and there are patterns. There are patterns. People seek out certain female physicians or certain, time of day or whatnot. So you may get a certain kind of patient. All of this needs to be talked about. And somehow we never make the time to do it.
I observe that there's also a lot of psychological stress amongst physicians, and it's very apparent to me from the outside. But again, it seems to be, just for the same reason of coming across as, not able or not competent or whatever the reason is, it never gets talked about. And I see physicians suffering, and I use the word suffering, quite directly, like they actually suffer a lonely battle.
So, Praveen, I think at the end of the day, it's about having that balance and being able to speak up for yourself and having control of what you do day to day. So I think that if we start with the assumption that if we can have a frank conversation about what our capabilities are personally, and in terms of physical capabilities, emotional, as well as, how our work fits into our life, and then look at that with what our practice needs and see where we can meet in the middle, I think everybody will be happier.
Well, we're at the fork on the road right now as far as the industry is concerned. Here are endoscopists, physicians, like, who've dedicated 15, 20, 25, 30 years of their lives doing something in a certain way. And now here is artificial intelligence, digital biology in the form of liquid biopsy, or even stool DNA tests and so on. Whether we are there yet or not, but it is, the threat is looming quite large, and that's what Scope Forward has always been about, of actively paving the way for the future, not being passive about it, but looking at issues in the face and talking about it quite directly. So, all these different threats, and also consolidation, also this big brothers in the form of, what the health systems are doing or what big insurance companies are doing. And also, quite frankly, patients don't listen to doctors anymore like they used to. They don't trust. The trust between physicians and patients is at, I would say, at an all-time low. So all this, when you add it up, I'm sure it has a huge role to play in, what a physician thinks about her own field or his own field, right? Like, and it must take a toll on the mental makeup and on the mindset on what medicine should be. So perhaps the entire industry needs to switch gears. We all need to think differently. Maybe there are easier ways to make money within the same private practice that is not dependent on managed care, because all the startups are doing it. But I've said a whole bunch of things, but I'm interested in your reflections on all of this.
Let me just start out by saying that most of us who went into GI do love the hands-on aspect of it. Like, we love the procedures. We enjoy doing them. There's a skill set that you acquire over the years that I feel very valuable. And when I think about the fact that I left it probably at the peak of my technical skill, it's bittersweet to think about that, because I love being able to solve problems with my hands and my mind. But that physical nature of it, that's gone for me right now. So let me start by saying that so many of us love the technical aspect and the achievement-oriented or results-oriented aspect of procedures. So it's very hard for gastroenterologists like me at my stage in the career, in my 50s, to leave that part. So change is coming, and that physicians are very slow to change. We're very slow to change our habits. I mean, literally, when something is talked about in the literature, by the time that gets implemented in real life practice, it's years and years. But just like technology has been such a disruptor, and in a very short time, I think in this current situation, if we don't adapt, we're not going to be able to survive in our fields. So I think that there's no choice. The disruption will be put upon us, just like we don't have a choice when our hospital is acquired. We don't have a choice if multiple practices are aggregating for the good of the whole, right, to survive. We say, okay, but I find that physicians accept those things when they are put on top of them. I find that we are not proactive. And I think that's where we need to change.
And this whole doubt that physicians have, this is the strangest thing that I find, because my world revolves around doctors every single day now. They're some of the most brilliant people on the planet. It's not easy to become a doctor. Quite literally, it's hard work. They've struggled, studied, very intelligent, they're savvy, they're very knowledgeable, and so on. But what I see on the other side is a huge self-doubt, because the disruption is coming in the form of technology, in the form of business, largely. There's this big question mark on whether I am capable as a physician, like whether I'm capable of handling business or handling technology and so on and so forth. So this self-doubt looms large. And yet here you are, somehow you stumbled into the digital health world, and you're doing phenomenal. Like, it's actually, I would say, it's easy. It's like you said, it's something that you've always done or you intuitively figured out. And it wasn't really hard. The switch wasn't hard. So once again, what are your reflections? Is it true? Is my understanding correct?
Yeah, so I have to tell you that we as physicians in practice, we've been accumulating this huge knowledge base on how to deal with people, how to deal with systems, how to think about business, that it's just become part of our nature, second nature. We wouldn't call ourselves business people, but we are. We are psychologists. We are systems analysts. We are technical IT people. We are all those things. And like 3 years of school is not what we need to do to like learn those skills better, or 4 years of school. We've been living it. What I did in India with the new team members that I met, assessing what each person views as their own skill set beyond medicine. What am I good at? Maybe put it in the context of medicine, that being a physician for 25, 30 years has taught me to be good at. And don't use the word that taking care of patients. Yes, taking care of patients is a given. Let's assume you're good at that. But what about it are you good at? What about it at dealing with your staff, or dealing with the technology problems, or dealing with the hospital that you're good at? Assess yourself really honestly, and then you'll realize that, wow, like you can do far beyond just seeing patients day to day or doing endoscopy day to day. There's a whole breadth of knowledge that you bring to any industry. And I hope that industry realizes that physicians who've been in practice for 25, 30 years are literally a gold mine on how to solve problems and innovate and connect people. And what you said, connecting the dots is not hard for doctors. And we can do it at so many different levels, right? So I would say any doctor is very suited for business. And I think that if this disruption is coming, and Praveen, you're much better at speaking to that than I am, then I say, embrace it. Embrace it, figure it out. Don't give up what you love, but start the conversation and see how you can be part of that journey. And maybe you'll discover something so cool about your abilities that takes you to the new level, or a new level as a person. And I mean, at the end of the day, isn't that what we're all trying to be? Is just live, be better people, find our purpose, and make an impact.
I was in a conversation now a few weeks ago, with a younger gastroenterologist, and after whatever we needed to talk about, we got done with that. He's been looking at options beyond GI in the digital health space, and the wider industry. But he told me on the side, he said, "Look, Praveen, and this has just not got to do with gastroenterology, but he said, physicians in my generation, we're all just waiting to leave private practice. We're just waiting." Because the thing is, it's somehow like, the older generation has got one set of issues. The younger generation has got a completely different set of issues. I don't know which other word to use, but it's not cool anymore. I'm not. Maybe perhaps there's a better word to describe, but I don't think they find meaning for their time and the work. Knowingly, they get into the endoscopy room or their practice, saying that yes, a part of this is great, but there is a good part of it that I'm just doing that offers me no meaning. So my concern is, if gastroenterologists or physicians leave the field, which I'm seeing happen, and it happened especially during the COVID period and right after the COVID period, because I think people really started looking for meaning within themselves and looking for purpose. And they were asking, how did I contribute to this pandemic? What can I do differently? And I think different types of answers evolved. And for physicians, it's been hard. And I see a lot of them leaving the field. I see a lot of them shifting gears. I see this happening. I think it's a wave. So then if that happens, then what happens to the industry? Who takes care of patients? Or is that a concern, or any thoughts or reflections on this?
No, Praveen, it's very scary. I mean, I think that you're right. We're all searching for meaning. And then we come to the realization that, financially, I have enough to be happy, right? So what am I doing this for? And that sort of thinking, and then the crisis in the world all plays into making that forward decision. I'm actually very scared about where not just GI, but all of medicine is going. And I think that this is a time to take a real good hard look at our healthcare priorities. And, literally as a nation, figure out how we're going to meet the demand. Because what you said is 100% right. I have a daughter who's a fourth year medical student, and her perspective on medicine is very different from my generation's perspective on medicine. They're starting out with thinking about the work-life balance, which is not something that we thought about at all when we started, right? So that's a different way that they're entering their field looking at that. They're also so savvy with the whole digital piece of their lives, right? So this digital disruption that's going to happen to me at my age, they're embracing that. So perhaps they'll ride on that wave, and we come up with population health solutions that require fewer physicians in the mix, right? In terms of physically being present. So maybe there is hope for the future, that we use, telehealth and other means to really deliver healthcare in a more efficient way. But that's going to take a change from the ground up in industry, not just the digital health industry, but also in medical schools, in advanced practitioner schools, right? What is the supply and the demand? And how do we balance? So this is my fear. If we don't address that, which is the provider level question, numbers of providers, this new generation, my fears, won't stick around once the pressures to see more and do more occur. That's what my fear is. Mm-hmm. They will not have an hesitation to shift gears, to pivot, because they've been doing that their whole life. They've been shifting gears and pivoting all along. They're much better at it than we are. So they're not going to put up with the increasing demands at the sacrifice of their work-life balance. They will not. I mean, if you look at other industries, IT industries, what's the job retention rate? How often do people change jobs? I have friends whose children are in various non-medical fields. I mean, every 2-3 years, they're moving. I stayed with the same practice my whole career. Mm. There's a loyalty that I have that I don't see existing in this next generation. So that's my fear. When the push comes from patients, I need to be seen. I need more procedure demand, whatever. They will say no. They won't hesitate to say no. Then where will we be left? Either we'll be ready to provide other population health solutions, or then the whole infrastructure of healthcare crumbles.
Mhm.
And then you and I don't have anybody to take care of us. So we need to actually address this now.
While that seems to be at the core the right answer, there's a fundamental business problem here, right? Like, so there are physician salaries to consider, there are student loans to pay off. So there is so a young physician might say, how do I make the money to pay that off? And, are there enough companies out there that are willing to pay the salaries? Where does all this change? How does the business aspect of this shift? Just your thoughts.
Praveen, I actually think it's also such a fundamental need for governments to realize that if they don't support the people who are going to become providers of healthcare, whether it be at the physician level, nursing level, or PA level, any advanced provider, they're not going to have a system in which they can provide for their people. You need to take that out of the equation. I mean, if you look at what medical school costs right now in this country, and the fact that people are coming out with debt that's beyond belief, literally. Yes, it's a really real, tangible concern for people. But the problem is that this new generation is not going to necessarily willing to just sacrifice their work-life balance for pay either. They'll figure out another way.
Mm.
So the system is actually in dire need of repair. And I think that that priority actually needs to be supported by governments, not just our government, governments around the world, as well as industry.
This has been a fantastic conversation. Maybe there will be a part two in the future, but I thoroughly enjoyed listening to your views. Once again, Dr. Fehmida Chipty, Boston-based gastroenterologist, turned digital health chief operating officer. So thanks so much for sharing your views. Any final comments?
Praveen, thank you so much for the opportunity. I appreciate every opportunity to talk with you, by the way, because I always learn so much from you. But I want to just put it out there to all the people that are listening to this, that realize that you have so much more to offer medicine and healthcare than you even possibly realize.